everyone, welcome back to our channel. I'm Dr. Amel from City Skin Clinic, and today I'm going to be covering skin problems that particularly affect skin of colour and my best skincare tips for people with skin of colour. So before we get started, if you're new to this channel, welcome. Don't forget to subscribe to our channel so that you can be alerted of more of our content. And if you are a returning subscriber, welcome back. Thank you so much for your support. Let's get started. Firstly, just a quick intro into skin of colour. It's a term that's very widely used, especially in the US, but it's catching up elsewhere, including in the UK. And really what it refers to is non-white, non-Caucasian skin. And so that most typically, there's a bit of variation, but most typically it's Fitzpatrick skin types 4 to 6, so more melanin-rich pigmented skin tones, ranging all the way from olive to much darker brown and darker skin. And deeper skin tones. Why is this an important topic to cover? Well, traditionally, melanin-rich, more pigmented skin tones have been left behind in the world of skincare and in dermatology in general. There are some really shocking studies, both in the UK and the US, where the vast majority of doctors training in dermatology do not cover are not required to have any specialist training in treating skin of colour. And beyond beauty and skincare, this can be quite dangerous. So often things like skin cancers may look different in skin of colour, and doctors that haven't been trained in spotting these signs or haven't got experience in treating people with skin of colour may be more likely to miss these. So cancers may get diagnosed a little bit later. And when it comes to skin conditions, skin treatments, not everything that works well on fairer skin tones will work on skin of colour and might actually be sometimes dangerous to skin of colour. And I'm just going to quickly cover why that is, and we'll go through the skin conditions that particularly challenge skin of colour, and then I'm going to tell you a little bit about my top tips in terms of problematic skin products and skin treatments for skin of colour, which skin treatments work best, and how you can incorporate these tips into your skincare, and when you're choosing skin treatments to avoid any of the risks. So hyperpigmentation is probably one of the biggest problems that people with skin of colour face. So hyperpigmentation is where you get dark patches of skin, and these can be caused by anything. It can be caused by hormones and sun damage. So things like melasma and hyperpigmentation are very common and far more severe in skin of colour. They also affect lighter skin tones, but they're just much more concentrated and much more of a problem. The other thing is skin of colour is particularly prone to post-inflammatory hyperpigmentation. So that is when you get an injury or a trauma, and that leaves behind a dark mark in that area. And the reason that skin of colour is particularly afflicted by post-inflammatory hyperpigmentation is because people with skin of colour tend to have larger melanocytes. These are the pigment storing cells. They produce more melanin, so that's pigment, and that's what gives you more of a melanin-rich skin tone. And whilst this is great because it also reduces sun damage, because it acts as a natural filter, it's not enough by itself. You still need sunscreen. It's a very low protection against UV damage, but this is why people with skin of colour tend to be less likely to get sunburn, and skin aging related to sun damage is reduced in people with skin of colour. That same process that protects you and keeps you looking younger can also be quite negative. So when you have an injury to the skin, a trauma, and that could be anything, and these dark patches are typically very difficult to get rid of. They're not impossible, but that's one of the biggest concerns that I see in my clinic, and people in general with skin of colour suffer from, is hyperpigmentation, and particularly post-inflammatory hyperpigmentation. Another big problem that affects skin of colour more than other skin tones is abnormal scarring. So by that I mean hypertrophic scarring and keloid scarring. Hypertrophic scarring is when you get a scar, but it is raised, it's bumpy, it's big, it's much bigger than the confines of the scar, than the original kind of space of the scar or the injury. And those scars can be caused by anything, typically surgical cuts, but it could also be injuries. Anything like that can cause that sort of scar. Sometimes I've even seen it in people where on the chest because they have a pendulum or a necklace that rubs there a few too many times and they develop something like that. Or the other side of that process is keloid scarring, which is especially affects darker skin tones, and that's where the scar is raised and big like a hypertrophic scar, but it extends beyond the margins of the original scar. And keloids and hypertrophic scars are quite hard to treat because often they require surgical removal, although there are dressings and topical things that can help reduce them and shrink them, and things like steroid injections and other types of medicines. Although they don't do any harm, they do tend to be painful, they tend to be itchy. If they're in an awkward place, they might be rubbing against clothes. And so it is something that is quite important to think about if you are someone who has a history of keloid or hypertrophic or any kind of abnormal scarring. That's really important to bear in mind when you're considering particularly professional skin treatments that may require injections or needling or that sort of thing. Another condition that is more prevalent in people with skin of color is a condition called pseudofolliculitis barbae, or it's kind of razor bumps, and this is more likely to occur in people with thicker, coily hair that once you have a cut or a shave, the hair kind of bends back on itself, or it grows in an unusual direction, and you get these raised bumps, and they can also sometimes be associated with hyperpigmentation. Finally, in terms of aesthetic skin problems, there's also ashiness. And so anyone with skin of color will know that there's sometimes a tendency, if your skin feels dry, to also look gray or kind of ashy in appearance. Everyone gets dry skin. Skin of color is no different, but because of the color of the skin and the gray, flaky bits of dead skin, these just kind of play a trick on the eye and make the skin look more ashen than when it occurs in someone who is of a paler skin tone. There's also research to suggest that in some people, some types of skin of color, some people, just because of the lipid membrane composition of their skin, are more prone to increased transepidermal water loss, which is when water is lost through the skin. That's a normal process that happens in all of us, but if there's too much water loss, that can cause dry skin. And so I mention this because this is something that is important to consider when you're thinking about your skincare routine, and in general when you're trying to look after, nourish, and boost the appearance of skin of color. Finally, a couple of other things I'm not going to touch on right now because they're kind of more to do, they're more medical rather than cosmetic, but of course I mentioned earlier things like skin cancers look a little different in skin of color than they do in people with lighter skin tones. And so if you have any lesions, any skin changes, anything new or anything that's existent but that's changing in appearance on your skin, you should really go and see a dermatologist, and preferably one who is experienced in seeing patients with skin of color, and they're less likely to miss a diagnosis of skin cancer. Flesh moles, these are totally benign little moles. Everyone gets them, but they can look a lot more obvious in skin of color just because of the contrast and the pigmentation. So a lot of people might not like the aesthetic appearance of them and want to have them removed. Again, it's really important to go and see a dermatologist who specializes in seeing patients with skin of color, especially if surgery is likely to be an option, because they will be more mindful of things like risk of hypertrophic scarring and keloids. So you don't want to remove a benign lesion and then end up with something that maybe is worse in its place. So, and of course, then there are other diseases, things like vitiligo. Again, it's a condition that affects people of all skin color, same as rosacea, but in skin of color, there is just the contrast, particularly in vitiligo, between the lighter, the kind of the depigmented patches of skin and your regular skin make the condition look so much more severe, and there are sometimes cultural stigmas associated with diseases like that. I'm not going to cover it in this video, but I'm happy to cover these medical skin conditions in more detail and how they affect skin of color in another video. If you guys are interested, let me know. So now that we've covered kind of the big cosmetic skin concerns that skin of color faces, let's think about skin products. So I'm going to start with skin products and treatments that are really problematic for skin of color, and I'll explain what you can do about that. So firstly, skin of color is really prone, as we said, to post-inflammatory hyperpigmentation. So it means anything that can irritate the skin or cause any sort of inflammatory response can potentially cause post-inflammatory hyperpigmentation. And so that actually includes active products like exfoliating acids, particularly really strong small molecules that are quite active, like glycolic acid, but even some other more gentle alpha hydroxy acids can still, so even like lactic acid, which is super gentle in lighter skin tones, can sometimes cause problems in people with skin of color. Retinoids are the same. Retinoids are amazing. They're the best tool that we have for treating hyperpigmentation. But retinoids, if you start too strong a dose, and in someone with skin that doesn't handle new products or handle active products very well, you can again paradoxically risk post-inflammatory hyperpigmentation by irritating that skin. So what do you do about that? Well, the good news is none of these treatments are out of bounds, but there's just a couple of things you have to consider. When you have skin of color, first and foremost, never ever start with the highest strength or dose of anything, no matter how much your skin needs it. Always, any new product, always start with the lowest concentration, the lowest frequency possible, and gradually build up. And before you do anything, put anything on your face, always do a small patch test first. So you put a little bit, normally a good place is the arm, the inside of the arm, on the collarbone, and check that for 24 hours and see if it irritates the skin, if it causes any problems, any reactions, then that product is a no. If it's fine, then it's okay, probably, but proceed very carefully. So that's one thing you can do with problematic skincare products like that in skin of color. I personally don't think anyone should use physical exfoliants, especially on your face, because they cause micro injuries in the skin, and that kind of, this kind of skin damage, it thins the skin, it can leave hyperpigmentation, and in skin of color, it definitely increases the risk of post-inflammatory hyperpigmentation. So if you're looking for exfoliants, you're better off with gentle exfoliating acids. Like I said, take small steps, whether it's an alpha hydroxy acid, a beta hydroxy acid, or something even super gentle like a PHA. And you can also consider things like enzyme exfoliants. But again, start with something very, very low concentration, low strength, and do not overdo it in terms of the frequency, after you've patch tested, that is. And then you can always gradually increase the dose and the frequency as your skin tolerates it. So proceed with exfoliating acids with care. The same with retinoids, and if you're thinking of a prescription retinoid like tretinoin, then see a doctor who specializes or has experience in looking after people with skin of color, and they can work you up on that process and help you start on the right dose and the right protocol for you so that you don't irritate your skin. So that's skincare that could be problematic. What about professional skin treatment? So the two biggest concerns are usually chemical peels and laser therapy. Both of these have a really high risk of causing post-inflammatory hyperpigmentation in skin of color. Chemical peels can be safe in skin of color, but it's a matter of firstly seeing someone who is experienced in treating people with skin of color. They can choose the best chemical peel and the safest strength and the safest protocol for your skin, and one that will target your specific skin concerns. So that's a really big deal, because there are hundreds of different types of chemical peels, so many different strengths, different protocols, and also they can advise on how to prepare for the peel before and after to again minimize to minimize the risk of post-inflammatory hyperpigmentation and burns. So chemical peels, big problem if they're not done properly. And the second biggest problem, treatment that causes problems with skin of color, is laser therapy. The laser's energy is absorbed by pigment, so people with skin of color. So because the laser's energy is absorbed by pigment, that means people with skin of color are more likely to absorb more of their energy, and that basically makes the laser therapy far more powerful. And whilst that might sound like a good thing, it's not, because that puts the skin at increased risk of burns and post-inflammatory hyperpigmentation. So you don't want to be in that position. And so with laser, my biggest advice, like chemical peels, is see a specialist clinic that is experienced at least, but preferably specializes in treating skin of color with lasers, because that means they will choose, so there are loads of different types of lasers, and most places tend to have one or two, especially small places, generic lasers, and usually those are the ones that work best in people with lighter skin tones. So you want to make sure that it's somewhere that has laser options that work best for skin of color. You want to make sure that they have protocols that they can use for people that work better on people with skin of color, and also that they're going to offer you the right aftercare and even prep advice for skin of color, also that you get the most out of the treatment without putting your skin at risk of burns or post-inflammatory hyperpigmentation. A couple of other really problematic skincare treatments are, I would say, dermaplaning. To be honest, I think most people should avoid that, because most places that offer it aren't, because of the risk of if someone slips or something happens and then you basically get a cut and a scar down your face. And that could be even worse if you have skin of color, because of the risks of post-inflammatory hyperpigmentation, but also the potential risk for hypertrophic scarring or keloids. So avoid those, please. And then microdermabrasion, I know that's quite popular and people love the idea of how it makes the skin, but this is really just a professional physical exfoliant, and I'm not a big fan of physical exfoliants for anyone, but particularly for skin of color, because they cause micro tears in the skin that accelerates both skin aging, and in skin of color can also cause post-inflammatory hyperpigmentation, because remember, in skin of color, any type of trauma can cause post-inflammatory hyperpigmentation. So those were problematic skincare treatments and professional skin treatments. What can you do for skin of color? The good news is there's so much you can do. Even the problematic treatments that skincare products that I mentioned, treatments, they can be used, but with extra care and with more of a mindfulness for skin of color. But here are the things that are generally fairly safe to use in skin of color. So always start, make sure in terms of your cleansers and moisturizers, you're using really hydrating products that can seal in moisture, that can help protect your lipid barrier, and that will keep your skin super plump, super radiant, but also it'll reduce ashiness and just make your skin much softer and nicer. Look for products that contain vitamin B5, niacinamide, vitamin E. Look for, in moisturizers particularly, moisturizers that contain, and serums that contain humectants like glycerol. hyaluronic acid, polyglutamic acid, and look for occlusives in your moisturizing creams, particularly the one you use at night, things like ceramides. You want to look at things like squalene, which is both a humectant and an occlusive, and these seal in the moisture and reduce transepidermal water loss. If you have particularly dry skin, things like shea butter or Vaseline, again, will help seal in that moisture, and when you wake up in the morning, your skin will be super soft and smooth and look great. So that's what you should sort of be looking for. And with hydrating, with cleansers, look for hydrating products that don't strip the skin of its natural oils. Look for things that are alcohol and fragrance free, so that you're not irritating your skin and causing it to dry out and start to not look its best. And that's, to be honest, a good piece of advice for everyone, but particularly if you have skin of color, because it can, if it's looking dry and flaky, it just looks more severe because of the pigmentation. And in terms of active products, so you've got things like azelaic acid and vitamin C. They're generally really good. You can use them to help brighten and even your skin tone and make it look radiant. With vitamin C and azelaic acid, start on the lowest doses and always patch test first. Benzoyl peroxide for acne breakouts is generally safe to use in skin of color. Salicylic acid is generally safe, but again, patch test before you use it if you're having very oily skin or acne breakouts. For people suffering with, and in terms of retinols, like I said, retinols themselves are not a problem. It's just that a lot of what's available in the market might be quite high strength, and a lot of the advice is tailored against people who don't have problems with post-inflammatory hyperpigmentation. So if you're looking at over-the-counter retinols, maybe start with gentle things like retinaldehydes that are less likely to irritate the skin, and start maybe twice a week and build up gradually. If you have severe hyperpigmentation or problems that need something stronger, you can consider prescription retinoids like tretinoin. Again, see a doctor that specializes or has experience in treating patients with skin of color, because they can start you on the right dose and the right protocol so you don't irritate your skin and you get the most out of the results. People with severe hyperpigmentation with skin of color often benefit from a combination of something like a prescription retinoid like tretinoin and hydroquinone, and I've covered hydroquinone in a couple of videos, and I'll put a link to below for them. Please see a doctor who's experienced in seeing people with skin of color, because with hydroquinone, it's a really powerful treatment. It's one of the few treatments that can really combat severe hyperpigmentation of skin of color, but it has to be used carefully so that it's used for a short time period. Often, for example, for my patients, I like to combine it with something like tretinoin, and then they can advise you on what to step down from, or if you need to continue hydroquinone for longer, if there's going to be a cycling period, so that you avoid any of the serious side effects of hydroquinone. So that's really important. These are all skin products that you can use really safely and effectively. And of course, sunscreen. I think thankfully things are better now, but for a long time people thought that people with skin of color didn't really need sunscreen because they have this built-in protection. Whilst yes, your skin is less susceptible to UV damage, you don't have enough protection from darker skin that it prevents you from getting things like skin cancer, or even getting photoaging or hyperpigmentation from the sun. So it's really important, regardless of your skin color, to use sunscreen, a broad spectrum sunscreen with at least SPF 30. Find one that doesn't have that horrible grey cast appearance. So usually chemical sunscreens are a bit better for that. There are also some amazing brands that are specifically designed for people with skin of color that make your skin look great and not ashen or grey looking. So yes, sunscreen is one of the most important things you can do for your skin. Anyway, I'm going to leave it there. I know this is a slightly long video, but I hope you found it useful. Please leave a comment below if you have any questions about managing skin of color, if there are any topics you want me to cover in future videos. And if you've liked this content, please give this video a thumbs up. If you haven't already done so, don't forget to subscribe to our channel and hit the notification bell. Until next time, stay beautiful.